Of course, October is Breast Cancer Awareness Month. The American Cancer Society estimates more than 310,000 women will be diagnosed with breast cancer this year. But there are multiple steps you can take for early detection and prevention. And here to explain is Dr. Lisa Larkin. She's an internal medicine and women's health specialist and the founder and CEO of Miss Medicine. Thanks for joining us.
Thank you so much for having me.
Okay, this is always an important time of the year to talk about this and really get the awareness out there. What are the three things that women should know when it comes to breast cancer?
So the first thing I want to get out there is really mammography is what we've been focused on, but I want women to know that there are things that they can do to prevent breast cancer. And just like we talk about lifestyle to prevent diabetes and heart disease, it's really important that women know that lifestyle impacts breast cancer risk. In fact, we think if women had perfect lifestyle, that's eating a healthy diet, maintaining an ideal body weight, exercising, not smoking, limiting alcohol, that we could prevent 33% of breast cancers in the United States. And the goal is prevention in addition to early detection. The second thing is good news. This year, the mammogram guidelines really came more into sync so that now really all of the professional societies say start getting your mammogram at age 40, and that's really important. Early detection matters. So survival correlates with size of tumor at diagnosis. And the third thing is, this is really important, is all women should know their breast density. So this is something I've been talking about for a long time. About 10 years ago, no one really knew their breast density. Now women are being notified of their breast density in their mammogram report thanks to a federal legislation, and all women should know that.
And you touched on that. Now, with some women with increased density, they're getting these mammogram letters telling them to talk to their doctor about additional screenings, and that can be scary. Can you talk to us about that?
Right. Well, so the first thing to know is that mammogram is a great test, but it's not a perfect test. No test in medicine is a perfect test. And so what we know is that with women that have increased breast density, and that's about 50% of women, that it decreases the ability of mammography to see small tumors. And so that's problem number one. Problem number two, depending on the amount of density a woman has, and a density is related to how much glandular tissue they have, that increases breast cancer risk as well. So women who have very extremely dense breasts, their breast cancer risk over their lifetime is elevated.
And does that mean all women with increased density need to get a breast MRI?
Right. So the letter that women are getting now says talk to your physician if you're one of the 50% of women that have increased breast density. The guidelines in this area are a little bit confusing. What I can tell you is that the more dense breast you have, extremely dense breasts put you at the highest risk, and most of those women should have additional imaging. With really in our city, there's multiple different types of imaging you can get, but in Cincinnati, most people are getting breast MRI. In that intermediate category, that's where the guidelines are a little unclear. What they all recommend is having a risk assessment done so that you understand what your individual risk of breast cancer is compared to population. And any woman who has a risk above 20% for their lifetime should have additional screening. And that's one of the key messages I would say, is that all women should know their density and all women should have a breast cancer risk assessment done.
Yeah, and that risk could point to family history. What are some other
so
factors?
There's lots of other things, right? So breast density is the single most important other factor to know beyond genetics and age, but number of children, age of puberty, age of menopause, age of first live birth, your body weight, there's multiple things that we take into consideration in kind of helping women understand their risk, their actual risk.
And what can women do right now?
Right, so talk to your physicians about your own breast density, your own individual risk, and if your physician is unclear, or your clinician, about how to calculate a breast density, try to get resources and find a physician that does. And certainly that's one of the things that we do in our practice.
And you see it on your screen, that free risk assessment QR code. If we could get that back up there for viewers. It is important to get this checked out. Prevention is key. Dr. Lisa Larkin, thanks so much for your insight here. There are multiple ways to get in touch with Dr. Larkin. We've got all of her websites on your screen right now, and we'll have them on our website, WLWT.com as well. And there is another look at that QR code for a free risk assessment. It'll be open to just 30 people, so be sure to scan the QR code there on your screen to make sure you get in. Again, thanks so much, Dr. Larkin.
Thank you.
Now let's send things over to meteorologist